Hello everyone. In this presentation, we're going to be talking about the characteristics of NasoPore and HemoPore. As you know, we have many options for spacers and hemostasis after sinus surgery, which each have their own characteristics. Here we're going to explore these characteristics for NasoPore and HemoPore. As an anecdote, I've been using this for as long as I can remember in practice and really have never looked back. I'm blessed to be able to tell you that I have an anecdotally low revision surgery rate for my own practice. But as much as there's never any complete replacement for sound surgical technique, I think it's really important to recognize how some products can, in fact, enhance this. So a little bit about myself. I'm Bhandarkar. I'm a rhinologist at the University of California, Irvine. I've been here now for 10 years, and that was after completing my fellowship with Dr. Tim Smith at Oregon Health and Science University. So with respect to NasoPore, the product portfolio has different options for consistency and fragmentation time. Personally, I prefer the extra firm because it gives me the most durable separation and prevention of adhesions and early hemostatic capability from pressure. The additional latency of the product stay provides a moist healing environment to minimize dry crusting. So this all really works well for me, but you can see here that there are certainly other options with respect to the consistency and duration of stay in the nasal cavity and sinuses. So we have the standard version that fragments in 7 to 10 days and has gentle compression strength, whereas the firm is slightly longer than that, and the fast dissolving AKFD is slightly shorter than that. But you can see the extra firm has sort of the longest fragmentation time and the most compression strength. So again, that's something I really value in my surgeries and I think works really well. The other aspect of these products, other than being bioresorbable, is that they have a number of other characteristics which are really favorable when it comes to optimizing outcomes. And these fall into three main categories. 1, space occupancy for moist wound healing. 2, separation of structures to prevent adhesions. And 3, hemostasis either by direct pressure or surface platelet aggregation and activation. So these are really key qualities that we value in sinus surgery to help optimize our outcomes. And this is the left nasal cavity and middle meatus post-sinus surgery. You can see the middle turbinate medialized in position here, and the placement of a piece of extra firm NasoPore adjacent to that within the middle meatus to provide support and stabilization to the middle turbinate, as well as the compression of surrounding mucosa that we talked about. So you can see that in this video that product was very easy to place. I feel confident in where it sits and its ability to maintain medialization of the middle turbinate. And with the concept and characteristic of 36 to 48 hours of tissue support, I feel that this provides an optimal stabilization capability for the middle turbinate, which is a really important aspect of optimizing outcomes after sinus surgery. So moving on to HemoPore, it has similar composition to NasoPore standard, but contains chitosan, which assists with platelet aggregation and therefore hemostasis. You can see here how these characteristics compare with other options. I tend to use this more when, by intraoperative assessment, it appears that bleeding is a higher risk occurrence than adhesions. This would most frequently be the case, for example, around the sphenopalatine region. It can also help as a prophylactic in patients on anticoagulant therapy, where they either may not be able to stop the medication perioperatively, as we would typically consider optimal to prevent bleeding during sinus surgery, or they may need to restart therapy prior to complete mucosal healing in the postoperative period. HemoPore acts by means of 2 mechanisms. So in comparison to other products available, and here we see NasoPore Firm, the other 2 products that you see here, Zerogel and Posicep, which are 2 other chitosan-containing products. The activation and aggregation capabilities of HemoPore outpace those of comparable products in this graph. And so those are characteristics that help us with respect to hemostasis during sinus surgery or to maintain hemostasis following sinus surgery. In this next video, we have a depiction of debridement of NasoPore following sinus surgery. This is a patient that is now approximately 10 days after sinus surgery, and you can see here the majority of the NasoPore that was placed in the middle meatus is now gone, and we have good support to the middle turbinate. The remainder of the product is sitting far back in the sinus cavities around the sphenoethmoidal region, where in that region I placed it primarily to help with hemostasis around the sphenopalatine region, just for basic compression, not with any significant risk of bleeding. You can see how easily it debrides with the suction, and there's really very minimal crusting around the sinus cavities because of that moist wound healing environment. Here's the left side where more of the product sits still in the middle meatus, but again, easy to debride. There's a little bit more of the product posteriorly and somewhat of a firm crust, but with this patient having irrigated frequently after sinus surgery, which I always have people do unless there's any concern otherwise, this crust was easily movable, also relatively moist around its edges, not adherent to any mucosal structures, and came out quite easily and nicely during the debridement. So once we have that out, then we can see there's a little bit more product around the posterior sinus cavities here, around that superior turbinate cut edge, and the remainder down below here, which was easy to remove, and a nicely wide open sphenoid. And you could see on both sides really that the sinus cavities have healed quite nicely. So in summary, these products provide a certain convenience because of a number of characteristics. We talked about the different fragmentation times and compression strengths to suit patient and your individual needs. For example, I mentioned earlier that the extra firm in general serves the characteristics that I prefer in sinus surgery. Your individual preferences may be different. It is 100% synthetic with no need for advanced preparation and no need for manual removal. It is 100% bioresorbable. And I think that's important to consider, especially in the current climate that we have with COVID-19, where perhaps a situation where we can avoid a post-operative visit where we have the confidence that irrigations alone can allow most of this to extrude and dissolve could be something that you find beneficial to avoid an extra episode of care and potential risk. The product is easy to place, as you saw in the video, but what I think is important to go over in more detail is that it's also easy to cut and shape to optimize to your individual needs. One really nice thing about this versatility is that a single piece can be easily cut to fit the anatomy, where smaller pieces may be appropriate to place in the frontal sinus outflow or the sphenoethmoidal region, for example, or a larger single piece may be more effective for middle turbinate stabilization. When I do a full house bilateral sinus surgery, I generally am able to cut a single 8-centimeter piece of extra firm NasoPore to accomplish all of these outcomes. And finally, it's comfortable for patients. It's hard to assess, but early on when I initially started using these, I would assess overall post-operative pain between placement of NasoPore and without. And I think ultimately the post-operative pain from the surgery really supersedes any possible pressure effect from the NasoPore when it's still in its dry form. Once it moistens, it's my opinion that becomes a lot more comfortable, and I really haven't had patients complain about having it in there afterwards. So as you're all thinking about optimizing healing and outcomes in sinus surgery, I think it's important to remember all of these key characteristics and decide when, where this product may be appropriate to use in your surgeries to achieve the same optimization of outcomes that I've been able to enjoy in my practice. Thank you for your attention.